We're heading into the intensive care unit to look at a genuinely high-stakes medical mystery. Today, we're focusing on that absolutely critical hold your breath moment, taking a patient off a ventilator, and we're going to uncover the ultimate life-saving treatment to prevent a truly terrifying complication. I want you to put yourself right there at the bedside for a second. It's a tense extubation procedure. Your critically ill patient has finally stabilized, right? The medical team decides, okay, it's time. The breathing tube comes out smoothly. Everyone in the room breathes this huge sigh of relief. But then you hear it, a harsh, high-pitched wheeze echoing across the room. The patient is suddenly struggling for air. That terrifying sound, that is the absolute villain of our story today. We call it Stridor. Basically, it's this harsh, vibratory noise that happens when turbulent air tries to force its way through a partially obstructed airway. And usually, this is caused by laryngeal edema or severe swelling right after extubation. Literally, in a matter of seconds, it threatens to undo all the hard-earned progress that patient just made. And honestly, it triggers this nightmare domino effect. Look at this progression. First, you have the mechanical intubation, which obviously is absolutely necessary to save the patient's life, but it inadvertently traumatizes those super delicate tissues in the throat. That trauma causes the swelling, the laryngeal edema. So when you pull the tube out, that swelling narrows the airway, giving us that stridor wheeze. And if it's severe enough, extubation failure. The patient has to go through a dangerous reintubation, which means a longer hospital stay, way higher costs, and, crucially, a drastically higher risk of mortality. So yeah, we absolutely have to break this chain. Which brings us to part one of our explainer, the steroid contenders. Now, to break that vicious cycle, the medical community relies heavily on steroids to rapidly knock down that inflammation. But here is where the mystery really gets interesting, because not all steroids are created equal. Historically, doctors have constantly debated which of these three specific drugs is the ultimate heavyweight champion for the job. We've got dexamethasone, methylprednisolone, and hydrocortisone. All three are used in ICUs literally every single day around the world, but until recently, critical care teams haven't actually had definitive, ironclad proof of which one is the absolute best at stopping Stridor in its tracks. Well, until now. To finally settle this debate, researchers published a pretty incredible study in the 2023 edition of Frontiers in Medicine. They didn't just look at a few isolated cases. They analyzed a massive pool of 2,371 mechanically ventilated adult patients from all over the globe. Honestly, with a sample size that big, we can finally cut through all the anecdotal noise and find out who the real statistical champions are. And to make sure they were only using the absolute gold standard of clinical data, the researchers used a rigorous Prisma flow diagram. You can see how they systematically filter through hundreds of medical records, basically tossing out anything with flawed methodology, to isolate just the 11 absolute best randomized controlled trials for this tournament. So the data pool we're about to look at, it is rock solid. All right, moving on to part two, analyzing the network. So with all that high-quality data gathered, researchers used what's called a network meta-analysis to let the statistics essentially fight it out. It's actually super clever. These geometric webs map out both direct and indirect comparisons. Think of it like a massive sports bracket. Even if Team A didn't play Team B directly in a specific trial, the math can calculate who would win based on how they both performed against a common opponent, like a placebo. It's an incredibly smart way to mathematically crown a champion among all four nodes here, our three steroids and the placebo. Let's dive right into the first battle, fighting that villain Stridor. And wow, the data here is just undeniably clear. When you compare it against doing nothing at all, the placebo, methylprednisolone severely slashed the odds of a patient developing Stridor, with an odds ratio of just 0.22. Dexamethasone was right on its heels at 0.39. But check out hydrocortisone. It honestly struggled. Its odds ratio was 2.33, meaning it didn't significantly protect the patient at all compared to those first two powerhouses. And that leads us to part three, crowning the champions. Okay, so we know two of our contenders are doing great, and one is definitely lagging. But who takes the ultimate crown when we zoom out and look at the whole picture, preventing both that scary Stridor wheeze and the dreaded reintubation? Well, the researchers used a Sucra clustered ranking plot to figure that out. Essentially, Sucra scores the exact probability that a treatment is the absolute best. And when we map out the statistical rankings for preventing Stridor on the horizontal axis and preventing reintubation on the vertical axis, just look at the top right corner. dexamethasone and methylprednisolone completely separate from the pack. They absolutely dominate that quadrant, leaving hydrocortisone and the placebo way, way behind in the dust. Now, both of these top-tier drugs are clear champions for sure, but the data does show they specialize just a little bit. Methylprednisolone proved to be the absolute best at preventing that initial stridor wheeze, hitting a massive 97.6% rank. Dexamethasone, on the other hand, slightly edged it out as the top agent for preventing the actual reintubation itself, scoring an 80.7% rank. Basically, if you're a doctor standing in the ICU right now, picking either of these two drugs is going to be a phenomenal choice to protect your patient. But looking at all this, you've got to be wondering, why in the world did that third contender, hydrocortisone, perform so poorly compared to its peers? I mean, it's a steroid too, right? Why didn't it protect the airway just as well as the other two? Well, the crucial difference here comes down to their inherent pharmacological potency. Not all steroids pack the exact same punch per milligram. Get this. To match the pure anti-inflammatory power of just a single 1 milligram dose of dexamethasone, you need 5 milligrams of methylprednisolone and a whopping 25 milligrams of hydrocortisone. Because dexamethasone and methylprednisolone are just so much more incredibly potent at fighting inflammation, they are vastly superior at rapidly shrinking that dangerous laryngeal edema before the breathing tube ever even comes out. Of course, in medical science, you always want to double-check your findings, right? Especially when we're talking about the most vulnerable patients. So to ensure these two heroes were truly reliable, researchers stress-tested the data by looking specifically at high-risk patients. In the ICU, doctors often perform what's called a cuff leak test to identify patients who already have significant airway swelling before extubation. And guess what? When they ran the stats strictly on these highest-risk patients, dexamethasone and methylprednisolone still completely dominated. The results held absolutely firm. Which brings us to the definitive conclusion from the researchers in this 2023 study. They state it plain and simple. Methylprednisolone and dexamethasone were the most effective agents against post-extubation stridor and reintubation. This isn't just a cool statistical victory on paper. It practically hands critical care teams around the world a clear, incredibly powerful, evidence-based weapon to protect their patients during a really vulnerable transition. So I'll leave you with this thought. We've gone through the network meta-analysis together, we've seen the rankings, and honestly, the science is crystal clear. Now that we know exactly which treatments are the absolute most potent and effective, the real question is, how soon will every hospital update their protocols to make methylprednisolone or dexamethasone the universal standard of care? How many more stressful extubations can be made safer literally starting today? Thanks so much for joining me on this explainer, and remember to always keep questioning the science that shapes our world.